So in our first video, we talked about the basic biology of testosterone, and if you haven't looked at that video, go back and check it out. Today we're going to talk about symptoms, testing, and diagnosis. So, symptoms of low testosterone. Well, so the first couple of symptoms, and I would say the most self-evident symptoms, are things like low libido, just kind of not interested, and difficulty with erections. Those are really characteristic symptoms of low testosterone. In addition, things like kind of a lower energy, a lower vigor can be part of low testosterone. If the low testosterone sticks around long enough, you can start to lose muscle mass. Now, in the same way that it can take a while to build muscle mass up with exercise, it can take a while for the muscle mass to fade away, but if the testosterone stays low long enough, that'll happen. And then other things that can occur, like if there's a rapid drop-off in testosterone, guys can actually get hot flashes. You tend to see that, like guys who will start testosterone blocking medications in the context of treating prostate cancer tends to be more where you'll see that, but it can happen. Similarly, if testosterone levels low enough and low long enough, you can develop what's called gynecomastia, the development of breast tissue in men because of the dysregulation of androgens and estrogens. So those are the symptoms of low testosterone. So when should you test? Well, so if you have symptoms that are characteristic, you probably ought to go testing for that. So if a guy has difficulty with erections, lack of libido, if a guy has gynecomastia. Now, it's less clear, should we go looking at testosterone levels in guys who have symptoms that are kind of not the center of the bullseye, but are maybe some of the peripheral symptoms, so like reduced energy, for example. Because the problem is there's 101 reasons that your energy can be lower. So should we go testing testosterone because of lower energy? It's kind of controversial, and it's less clear on ones like that. But the clear ones are things like erectile dysfunction and low libido and low bone mass, or gynecomastia, for example. Okay, so that triggers the check. So then, how do you do the checking? How do you make the diagnosis? Well, so the diagnosis takes two separate things. First is symptoms, or in the case of low bone mass, signs that are consistent with low testosterone. And then second is laboratory evidence of low testosterone. So you got to check the blood levels. Now, I don't want to get too deep into the weeds on this with the technical details of measuring testosterone, but a couple of thoughts. One is that there's a natural cyclic rise and fall in testosterone with a circadian rhythm. And so the natural high level of, or highest level of testosterone is around 8 o'clock in the morning. So you want to check the level around 8 o'clock or so in the morning. And the second thing is because there can be variation from one day to the next, or influences on testosterone levels from other things, like are you sick with something else, or are you really stressed out, or whatever, you want to confirm a low reading. You don't want to make a diagnosis just based on a single reading of low testosterone. And then the other thing is, if the level's really low, you might want to go dig in for an underlying explanation rather than just say, oh, your testosterone level's low. Here's some testosterone supplements. So a little extra contemplation of the cause is often in order. So we talked about symptoms, talked about those symptoms and signs triggering a test, and then with the test, making sure you go about it correctly and get that pairing of symptoms and measured low testosterone levels to correctly make the diagnosis. Stick around for the third episode, which will come out next time, and we'll talk some about treatment with supplementation. For Sentinel Primary Care, I'm Dr. O'Connell.